As a new patient at 180 Physical Therapy, I hope you noticed a couple things on your first visit. One, we're going to listen to you talk about what you can and can't do because of your pain or your injury. Two, we're going to talk about returning you to function and setting goals for you. Three, we're not going to set goals that are going to focus on decreasing pain or decreasing swelling or increasing range of motion or flexibility. Our goals are going to be you returning to specific activities because that's the important part. Here at 180, we are vastly different than every other physical therapist or medical practitioner because we focus on science and we focus on the end result being return to function, not decreasing pain. So as we move forward, we're going to assess you every single time you come in. We're going to give you things to do at home every single time you come in. We're going to normalize your neuromuscular facilitation or your body's ability to have nerves communicate with muscles to increase your strength, increase your range of motion, decrease your swelling, and decrease your pain. So by doing that, we cover all of those bases. And you, as an active participant, are going to be given things to do at home. You're also going to be given a treatment program or a progression. So we might see you twice the first week, once the second week, and then say, hey, you look really good, come back in 3 weeks. If you feel fantastic the night before that 3-week visit, do not cancel that 3-week visit. Trust me, we are the experts, we know what we're doing, there's a reason why we said come back in 3 weeks. If we didn't say you're fantastic, you don't need to come back anymore, that still means you need to come back because we're still working on things. The whole point of what we're doing with giving you a home exercise program is to increase your muscle endurance, which will increase your strength and your stability and your motion and decrease your symptoms. If we want you to come back in 3 weeks, it's because we know that you will fatigue by the 3-week mark, which is why you need to come back in. It doesn't matter if you feel better. Remember, just because you feel better doesn't mean all of your problems have been solved. We still need to tweak some things. We probably are going to give you different exercises when you come back for that 3-week mark. So if you stop your treatment program before we get all the way done, the likelihood of your problem coming back within 2 weeks, 3 weeks, a month is very high. So we have people all the time that say, well, I felt fantastic, so I canceled that 3-week appointment, and wouldn't you know, 2 weeks later, I rolled my ankle again. Right, because you didn't finish your treatment program and your ankle wasn't ready to do what you asked it to do because you didn't have the muscle endurance and you didn't complete what we were trying to do with you. So we're going to do everything in our power to see you as little as possible and give you as much result as we possibly can in as few visits as possible. It's your job to do your home exercises as prescribed and show up for your visits as planned out and finish your treatment program. Trust me, if you do that, the chances of you returning to normal function and not having your problem come back are extremely high.